Hello viewers, I am Dr. Suma, consultant at Ferty9 Fertility Center, Vijayawada. So many people come to us for different treatments for infertility and we have so many solutions to offer to them. But does doing a fertility treatment guarantee you a pregnancy is what I am going to talk about. So what exactly are we doing when a patient comes to us for a fertility treatment? So we as a doctor and as a team can help the couple by increasing their chances of pregnancy by creating an environment where the chances of a fertilization or the chances of an implantation will increase. Say for example, when we do an intrauterine insemination or an IUI, we subject the lady for ovarian stimulation wherein the follicles are produced and we give an injection for the follicle to rupture, and once the egg is releasing, at the time of we time it around the time of the rupture of the follicle and we do an intrauterine insemination of the husband's sperm. So by doing so, we are introducing the sperms into the uterus of the female. We are introducing more number of moving sperms available for fertilization, as a result of which the chances of pregnancy slightly increases. But when we do an IUI, we are sending the sperms into the uterus. Now these sperms have to reach the tube, egg and sperm have to meet, that is fertilization has to happen, an embryo has to be created, and this embryo has to get back into the uterus and implant. So all of these are not in our control. So we cannot guarantee a couple a pregnancy with an IUI. It just simply increases the chances of pregnancy in that particular cycle, which is slightly higher than what they would normally achieve if they had an intercourse. So coming to an IVF, so many people think that if they go through an IVF where the doctor is stimulating the lady to produce more eggs, then they give an anesthesia, they retrieve the eggs, they fertilize the eggs artificially in the lab and create embryos. They select the best embryos and transfer it back into the uterus. So in IVF, we are more or less controlling many things which are not controllable in an IUI. But even here, when we transfer the embryos back into the uterus, the embryos have to implant and a life has to begin. Now this is again not in our control, because not all embryos are capable of a pregnancy, and not always the endometrium or the lining of the uterus is suitable for the implantation to happen. So only if we have a good embryo, a genetically normal embryo implanted or put inside the uterus, when the endometrium is favorable, will the implantation happen and will the pregnancy happen. So this again is not completely in our control. Usually on an average, the success rate of IVF depends on the age of the couple and the reason why they are undergoing an IVF. So the best success rate which a center can possibly achieve could be somewhere around 60 to 70%. That is if we get good quality embryos and the endometrium is suitable. But again, if the age is on the higher side, if we don't get good quality embryos, or if there is some problem with the endometrium, the success rate further comes down. So is there any process which can actually guarantee you a pregnancy? So as of now, there is no such process in the world which can tell you that this will 100% give you a pregnancy. But of course, we have many solutions which can help you improve the chances of pregnancy. So you have to come to us with a positive attitude, and that will definitely help you out, and whatever problems you have, we will go through all of that and suggest you the best treatment, and definitely it will be the way forward. There are so many treatment options available for infertile couples, and one among them is IVF, in vitro fertilization, wherein we collect the eggs from the wife, we fertilize them artificially in the lab with the husband's sperm, embryos are produced and these embryos are transferred back into the uterus. Now, is it true that only older women have been offered an IVF, or is IVF suitable for all? So the decision of whether we need to do an IVF for a particular couple depends on many things. Age is definitely a very important determining factor, and as the age increases, the fertility solutions that we have decrease and the success rate of these solutions also decrease. So normally we have two options for the patient, that is an IUI or an IVF, and IUI is a process wherein we artificially inseminate the female at the time of ovulation. This only improves her chances of pregnancy. So IUI success rates drastically decrease with age, and usually on an average after 40 years of age of the female, we usually don't suggest an IUI at all. We prefer going for an IVF. Now, does this mean that those who are younger than 40 years are not offered an IVF? Definitely not. We come across so many couples who are extremely young, but they have so many other problems wherein they have to go through an IVF. For example, if the patient has both the tubes being blocked, so if they have a bilateral tubal block, there is no way that the egg and sperm will meet, there is no way that the fertilization can happen naturally, so we have to offer them an IVF. Supposing she has a grade 3, grade 4 endometriosis, the chances of a natural pregnancy or a pregnancy through an IUI is extremely difficult, and even a grade 3, grade 4 endometriosis can happen at an earlier age itself, where we may have to suggest an IVF. Supposing the male partner has severe count problems or motility problems, that is the count is extremely low or the motility morphology is extremely low, then there is no other prospect but to go ahead for an ICSI. So, it is not just the age which determines what kind of treatment that the patient is offered, it is a combination of the age, the history of the patient, the examination findings that we have, the investigations that we do, and suitable couples only are offered an IVF. On an average, 80% of the couples in one single year will conceive naturally without any treatment, and this increases to 90% in 2 years. For couples who are married for less than 5 years, IUI really works well, and for couples who are less than 40 years, IUI still has a chance. So, but for couples who are married where the female partner is more than 40 years, I think IVF is a better option. Apart from these, where IVF is definitely indicated is when the patient has a bilateral tubal block, when there is a severe male factor infertility, when there is an endometriosis stage 3 or stage 4, in patients with PCOS where all the other options have failed, or when the patient wants to go for a donor oocyte, or when the patient has extremely chances of success with IUI, that is multiple cycles of IUI have failed. In these patients, definitely will offer an IVF irrespective of the age. So, definitely age is an important determining factor of which treatment we need to go ahead with, but doesn't mean that all older women have to be offered IVF. There are so many other determining factors which tell us whether the patient actually needs an IVF. Thank you.